Science matters. Science matters because people want to know what is going on out there and what is in the published literature. Those are our North Stars. That's what guide us. People say, I read this in this journal. This is Patty Fuentes.
Hello, everyone.
Patty is our research fellow this year. She's an absolute superstar and is author on our paper that just came out in PRS, and it is Awake Rejuvenation with deep plane facelift and extended deep neck contouring. That's a lot of words. What does that mean, Patty?
So essentially what our paper is looking at are outcomes of patients that have undergone deep plane facelift with open neck dissection under awake local tumescent anesthesia.
And the reason this is so fascinating, and these are my last 200 patients in here, it is very technically challenging. You're operating around a lot of nerves. You're removing submandibular glands. There are a lot of blood vessels. There's a lot of really delicate anatomic dissection. And traditionally, the patients would go to sleep under what we call general anesthesia. For about the last 9 years, I have been doing these operations under tumescent local anesthesia, which is a very erudite term for awake surgery. So tumescent is fluid that has in it medication, numbing medication, that we infuse into the tissue, and it's phenomenal for minimizing bruising, and it's phenomenal for accelerating and making more accessible the dissection, and probably most importantly, bringing in numbing medication so that people don't feel what's going on. If you're asleep, you don't feel what's going on, but you may still be having pain, and when you wake up, that pain surge may come to a crescendo. In our patients, that is not the case. These patients are comfortable throughout the operation and then all the way to the end of the surgery. And so what we really wanted to demonstrate by publishing this is that it's achievable, it's doable, not just in a few patients, in hundreds of patients. We tracked and followed all of the complications, and I would submit to you, please read it and compare it on your own. But the complications are very, very minimal and certainly comparable to any operations that are performed under general anesthesia. I have nothing negative to say about general anesthesia. I'm a big fan. I go to the hospital at least once a week to do surgeries under general anesthesia, but I have an operating room here where we do operations under tumescent local anesthesia at least twice a week. Arguably, there are more patients that we're operating under awake, and the recovery is fast. These patients are in the car going home 15 minutes after their surgery. And actually, it also gives a little bit of time to really become better associated with our patients. We're sitting there talking with them. Often we'll have one of our nurses holding their hand, play radio. We play whatever they would like to hear. It's a comfortable, relaxing experience. When they're finished, they get to hop in the car and head home. Or sometimes patients stay in the stay suites, which are just down the hallway here. The big part about this is to see this in print validates that this is a very acceptable and reasonable and achievable operation under awake conditions. What do you think?
I think it's a phenomenal procedure, and going from clinical to research and then actually seeing it in print is very exciting, and patients can read it and can see it for themselves, and everybody in the research community can now include this in their own practice.
Exactly. So. And you did a great job putting this paper together.
It was very exciting.
Yeah.
Thank you for the opportunity.
Well, thank you for all of your hard work. This is the hard work. This is the science. This is what validates and gives us the credentials to be invited to Brazil, to France, all over the United States to speak about this, because people want to hear this. They're desperate to hear this information, and it's fun to share.
Check it out.
Check it out.